Lewis was our oldest child. We have 2 children. He was really a live wire. He was a very lively boy. He was also quite brilliant. I mean, he was one of the most highly intelligent people I've ever known. And he learned a lot. He knew a lot of things, far more than most adults. So he had this sort of wide and varied knowledge. And he also had a wicked sense of humor. So he was, so other children really enjoyed him. He was just a fun kid. He had a condition called pectus excavatum, which is a condition in which the breastbone doesn't really grow straight. It's a cosmetic condition. We saw an article in our local newspaper talking about this safe, minimally invasive new surgery. And we ended up taking our son for pectus surgery. And Lewis came out of surgery, and we thought, phew, we've made it through that. About 3 days after surgery, he suddenly had this excruciating pain in his upper abdomen. He was prescribed a drug called ketorolac Toradol, which is an NSAID pain reliever, like aspirin. He developed a perforated ulcer because he wasn't properly hydrated at the same time. And no one noticed. He declined for 30 hours, and they dismissed it as constipation. By the next morning, he had no blood pressure. He had sky-high pulse rate. He lost 2.8 liters of blood, and for a child his size, I think he had about 4 liters altogether. You know, I watched the color drain out of his lips. It was just like water going down in a glass, and they turned the same color as his skin. Just all the pink left his lips. It's really hard to even imagine seeing something like that. And then he said to me, it's going black, and he went into cardiac arrest. Yeah, I ran out of the room. I thought he was having a seizure. I ran out of the room looking for help. These young residents and nurses were just astonished, and they worked on him for about an hour and a half before they gave up. But they never could bring him around. Losing Lewis has been devastating. I started Mothers Against Medical Error. When we came back from the hospital, the first thing we did was the legislation, the Lewis-Blackman Act. So one of the things that we have tried to work on is, full disclosure, informed consent, transparency, badges, labeling of people, because we had been misled about who was a resident and who was a doctor, and rapid response, having an emergency number for people to call, and allowing people to call their doctors as well. So those were 4 things that had come directly from our case that that we had seen, that we thought we could fix with legislation. Lewis was monitored, but it kept alarming, and they would keep setting it lower and lower. And finally they had it down at 85, and it still kept alarming, so they turned it off. Every patient deserves continuous monitoring. You never know what's going to happen, particularly with postoperative patients. Lewis is a prime example. He was a perfectly healthy child, which is why no one believed that he could possibly have anything wrong with him. So you need an objective observer like a monitor.